Ethical Perspectives on the News is produced by the Interreligious Council of Lynn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning and welcome to Ethical Perspectives on the News. I'm Heather Hayes, Associate Pastor at First Presbyterian Church here in Cedar Rapids, and I will be your moderator for this morning's show. One of the subjects that has been in the news as of late is the subject of childhood vaccinations. From concerned parents to celebrities, doctors to scientists and other healthcare practitioners, it seems as though everyone has an opinion on the pros or cons of the vaccination series recommended by the CDC. Proponents say that vaccination is safe and one of the greatest health developments of the 20th century. They point out that illnesses including rubella, diphtheria, smallpox, polio, and whooping cough are now prevented by vaccination, and millions of children's lives have been saved. Opponents say that the children's immune systems can deal with most infections naturally, and that injecting questionable vaccines may cause serious side effects. With the recent outbreaks of some diseases, however, such as whooping cough and measles, there has been a renewed scrutiny on vaccination standards. Just this past week in California, a bill has been passed in committee that would remove the religious exception clause from the requirement to vaccinate children that are entering the public school system. There's a lot of disagreement about this, so we've brought in a panel to explore the issue of vaccination and public health. To my immediate left is Sara Riley, attorney in the Tom Riley Law Firm.
Hello.
Welcome, Sara.
Good morning.
And next to Sara is Pramod Dwivedi, Lynn County Director of Public Health.
Good morning.
Welcome, Pramod. And then Susan Rummelhart, Health Services in the Cedar Rapids Community School District.
Good morning.
Good morning. So let's jump right in and set a bit of groundwork for our conversation. Let's talk a little bit about what are some of the concerns, first off, on one side, that people have who are in opposition to current vaccination practices. Could you speak a little bit to that, Pramod?
Yes, I think there are three reasons behind that. Number one is that, parents don't see those types of diseases, like measles or polio. We don't see that much here in our population. And then the second is that there is a pretty deep concern about safety of these vaccinations, that people always question, through different media that, these vaccines may not be safe. And then thirdly is that there is always fear among the parents that, kids are their prized, very valuable member of their family. So it's always a fear that, oh God, if something wrong goes, what would happen to my kids?
There's sort of that natural desire to protect your children from whatever it is.
Absolutely.
Or whatever potentially it might be.
So who would be the more protective of their kids than parents themselves? So those are some of the reasons, the main reasons I would say that, there is a very deep concern among some people that, vaccination may not be very safe for the kids.
Mm-hmm. So now on the other side of the coin then, what are some of the concerns of the public health system of which you're a part?
Well, we are really obligated and actually mandated to protect and promote public health, right? Mm-hmm. That's our job, and we look at the science, right? So based on the scientific information, based on so many studies that have been completed in past 20 years, there has no concerns in terms of vaccination safety. We provide that information all the time, and the main concern that came to, and as a father, I was concerned myself regarding one study that was published by a British medical doctor, but that study was never produced. So it was, when you cannot produce a study, then its reliability and validity is questionable. And over scientists try to replicate that study, but they failed to do that. and consequently that study was, completely bogus, declared bogus, and so that really caused a lot of issues and a lot of concerns among parents. And for us, we always advocate based on scientific understanding and knowledge that we have. I mean, if you look at the turn of century, I mean, thousands upon thousands deaths due to vaccine preventable diseases, right? I mean, polio, not too long ago, we saw in our population, we are talking about 40s, 50s, even that late. And before the implementation of the vaccine program in the United States, until 1962, almost all kids in our population had measles, and thousands would die. So, vaccination is really a huge, massive boon to protect and promote public health. So we very steadfastly, on the side of science, we really champion that activity in our population.
Now, one of the things that you sometimes hear about is the concept of herd immunity. Could you talk a little bit about that?
Yeah, so herd immunity is really immunity that protects a group or a community, okay? So if there is an invasive agent, infectious agent, for example, if there is immunity in based on the type of infectious agent or invasive agent we are talking about, large number of population, if they are immunized against that agent, then we call it herd immunity. So most people, like in measles case, for example, we can achieve herd immunity if there are 92 to 94% or 96% people are immunized. So it really protects others. I mean, there are people in our population who may not be immunized, like, immunocompromised folks. If, they're cancer patient or heart transplant or any organ transplant, so they are not supposed to get immunization. So if there is herd immunity in our population, we are protecting them also. So we say that those who can get immunization should get immunization.
Okay. So do you have any ideas about what percentage of the population might be immunocompromised in some?
So there is no specific data on that, but based on some estimates, there are about 3 to 4% in general population, people considered immunocompromised, and that's again, based on some studies. Yeah.
Okay.
We don't really track immunocompromised folks.
In Mississippi, where they do not have a religious exemption or a personal belief exemption, only 0.1% of the incoming kindergarten students are not immunized. And those people who aren't are because they have an immune compromise. So it really is a very small percentage.
Okay.
Because those are all documented. They in Mississippi, you don't not get vaccinated unless you show the documentation.
Okay.
And our vaccination rate here in Iowa is outstanding, really. I mean, measles we have about 95%, and there are some, exemption due to medical reasons or due to religious reasons. And California is really, that law that's still pending in the Senate or House is going to address that loopholes, religious or philosophical exemptions.
Well, I have children myself, so I know what a playground for germs sometimes the school system can be. California is, I also know that I was asked for my children's immunization records as I went in, as they enrolled in kindergarten. Can you share with us, Sara, a little bit about what specific concerns schools have related to the vaccination of the children in the schools?
We have to follow the law. The purpose of the health services in any school district is to provide a safe, healthy environment. So when you get kids that are not immunized, that's not safe and that's not healthy. And Iowa law does require immunizations for entrance into schools. However, it doesn't prevent, for Texas, for instance, you cannot enroll without showing it. You cannot walk in the door. Here we have what we call provisionals, where we will give them 60 days to come up with their record, and or if they're not immunized 100%, they're missing some, then they have 60 days to start getting those missing immunizations. So it's kind of a, we have kids that are non-immunized. The other thing that Iowa has, again, because we have to follow the law, is they're allowed to have the religious exemptions. It's not a philosophical one. However, you only have the only thing you have to do is take it to your neighbor that's a public, whatever they, notary.
public.
And they sign it and it's good. Whereas if you have a medical exemption, it has to come from a licensed medical professional, either a doctor, a DO, a nurse practitioner, or a physician's assistant. It's limited to those 4 people. But the religious one, unfortunately, anybody can sign it and bring it in, and if you have it notarized, it flies. So we don't really see that many of them. Here in Iowa, it's a lot worse than a lot of other states where they're really used a lot. But there's a lot of states that have the philosophical, which increases your number of exemptions.
And can you speak to what is the philosophical?
Philosophically, you don't
exemption?
believe in the immunization. Kind of what he was referring to, that the parents feel that it's dangerous for their children, so you philosophically cannot do it to your child. That is but we don't have that. We only have religious.
Yeah, it's called personal belief exemption. So
Right.
as long as you have a personal belief, it could mean you were watching, I was watching Bill Maher last Friday night, and they had Robert Kennedy Jr., who is apparently an anti-vaccine person, and he made the comment that, when he was growing up, they didn't have autism. And Bill Maher did correct him and said, yes, they did. And, you also didn't see homosexuals because they were in the closet. But yes, there were autistic children and there were Asperger children. And it was just you didn't see them because they weren't mainstreamed. But, somebody told him that vaccines are dangerous. So now he's going out telling other people. So people hear something from somebody they respect or from a movie star and they decide, I don't want to vaccinate my children. And in 20 states, I believe it is, they have
philosophical exemptions.
Yeah, which personal belief, philosophical, either way, what word you want to use it, but
And 48 have religious exemptions, and all 50 have medical exemptions. Just to add one point, that the licensed daycare facilities are also required to have vaccinations. Yeah.
Okay.
Yeah. And Lynn County Public Health, our department here, actually conducts a very comprehensive audits of all Lynn County school districts. So we make sure that the kids that are in the school are immunized and they have exemptions, based on the law that we have in Iowa.
And I'm assuming preschools and all of those too?
Yes, everybody that is part of that building, the school building. We don't go out for the daycare at the moment, but if the daycare is within the school building, we do audit that too.
What's interesting when he said that 48 do not have religious, or do have the religious exemptions, Mississippi and West Virginia are the 2 that do not provide a religious exemption. And Mississippi and West Virginia have the lowest rates of people not vaccinated because they're very strict on it. And Mississippi's considered, the heart of the Bible Belt. So it's not that they don't respect religion. It's just, and they are the worst in all the other indications of health. But the one thing that they've done right has been the vaccines.
Immunization, yes.
Yeah, which is, and that's one of the things that California has.
So I was going to say, let's move to California. So what California is looking to join?
They are. The funny thing is Mississippi actually was looking, before the outbreak at Disneyland, there's a very large anti-vaccine movement, and they have every year tried to get the Mississippi law to allow personal belief exemption. And they've come close before, and they had it before again this year, and then after what happened at Disneyland, they didn't even have it come out of committee. But what happened in California is with that horrible outbreak at Disneyland, and what happened is they don't know who it was, but it literally only took one person that had the measles, and they went to both of the two parks, California Adventure, I think it's called, and then Disneyland. There's two separate parks right next to each other. And they're in close, confined spaces, and literally hundreds of people from a number of states, fortunately none of them from Iowa, came back to their states, and the kids who weren't immunized, they caught the measles. And because it got so much press, not only because it was Disneyland, but also because it was measles, which we thought was pretty much eradicated, California looked at, and then Mississippi got so much positive press that I think California was thinking, wait a minute, we can do as good as Mississippi. We can, and California, while they're actually 34th in state as far as where the states are in immunization. The worst is Oregon, with 7% of their students having no immunizations, which is pretty high. 7% of their incoming kindergarten students, which is not something to be proud of. And California's isn't as bad, but there are pockets, and they're actually in the wealthy and in the well-educated areas where they have some school districts where more than 50% of the students are not immunized, which really presents a problem for the children who have compromised immune system who can't become immunized. Maybe their siblings are immunized. The parents understand the importance of immunization, but they've had cancer. They can't be immunized. And so they don't get protected by the herd mentality because there's nothing close to a herd there. So.
And the other aspect is the child's too young to receive the vaccination.
Right.
And so there's nothing you can do about that.
Right.
It's someone, a 2-month-old has not received a pertussis vaccine yet. A 1-year-old is getting their first measles. So those kids are just at liberty to to anyone that's not getting it. So at least if their siblings can bring it home from school from a non-immunized child, if they're immunized, then they won't bring it home. But there's you go to church and you're going to get exposed to these kids that are not immunized, and you have nothing you can do to protect your baby.
But we should at least protect them at school. You can't, and that's what you can do is while you can't say, okay, if you're not immunized, you can't go anywhere. We're not going to do that. But we can say you're not going to the public schools, and in most states they would also say the accredited non-public schools. If it's a non-accredited school or homeschooling, then you get to set your own rules.
Well, and I think that was part of the debate in California was that whether or not the homeschooled children would or would not be considered as part of that. And I think they took that off the table, and then it passed.
They did, and I can understand that. I don't know how many people are going to say, I care so much about not vaccinating my children that I'm going to homeschool them. I mean, maybe some of them are already homeschooling, in which case that's fine. A lot of people can't really afford to quit their job and homeschool just to keep their child from getting vaccinated against measles.
Yeah, and measles actually, is a tribute to public health community or public health system that it was eliminated in 2000. Completely gone. There, we haven't seen any case until now in December last year. So I think the progress that we have made, we don't want that progress to go away because some parents decide not to vaccinate their kids. So it's a threat to the entire population.
Right.
So.
And as bad as it is, I mean, while measles, people do die from it.
Yep.
The idea of what if polio came back? I mean, I'm 55, so I've seen people not my age because everyone my age was immunized. But I had friends whose their parents were not able to walk normal because they had polio. And I don't think these people who are not immunizing their children understand that if enough people stop immunizing their children, somebody from a country can bring just because we're saying there isn't polio, they can get it.
Yeah. And it may not be in the contiguous United States, but it's still existent.
Yeah, we are a small world. It's not just a Disneyland song. I mean, we are a small world.
Yeah. So, global village, and people are traveling so much. Mobility is so much that a disease can pass very easily.
Look what Ebola came from. Somebody had come from Africa, and didn't realize he had it. And
Yeah.
fortunately, it was very contained.
Right.
And here you had this hysteria over something that actually is very hard to catch, and yet you have something that's measles. Somebody who's infected with it has the ability to infect so many people, and when they leave the room, that infectious organisms are still in the air and still all over for hours.
Right.
So let's talk a little bit about the fact that, I mean, this is about vaccination, but there also is a little bit broader issue as to, does the government have the ability or the right to intervene in personal medical choices? I think that's one of the other pushbacks. How is the government able to legislate what I do with my body or what I do with my children's body?
Well, and they wouldn't go in and force you to do it if you're not going to go out in public. If you want to live as a hermit, no one's going to go and tie you down and inject you with a vaccine. But in 1905, the U.S. Supreme Court held that cities can, this was with smallpox. I didn't realize when the vaccine for smallpox had come out, but obviously it was already around long prior to 1905 to make it to the U.S. Supreme Court. There was a town that had an outbreak, and they required everyone to be vaccinated, and somebody didn't want to get vaccinated, and the U.S. Supreme Court said, nope, the government has a right to say it because public safety is so important. And there's been cases since then. So the government has a right because the U.S. Supreme Court says that they do.
Yeah, and we do have, the law that requires us, if there is a threat to public health, we can isolate people, we can quarantine people. I mean, TB is one of the examples that if there is a infectious TB case, we quarantine and we isolate that person. And if there is a threat to population, we have that authority to do isolation and quarantine. And that's one of the measures to protect public health.
So where does who is able to make that call?
Who we elect.
Who we elect.
If you want, like in Iowa, we have
in terms of a particular thing. Who at that point in time says, okay, you.
Well, the Iowa legislature and the governor signed a law in Iowa, and that's our law. And there's 50 states, and then the District of Columbia, and they each have different laws, which is why 48 or all 50 states allow for the medical exemption, and 48 states and the District of Columbia have religious exemptions, and then you have 20 that have the personal belief exemption. So those legislatures made the law, and they're the ones who make the determination. When my youngest was going to school, the chickenpox vaccine was not a required vaccine. Eventually, you had to show that you had either had chickenpox, which was, or you've had the vaccine, but that wasn't until she was much older. My youngest. But now I happen to read, and it's one of the required vaccines.
Right. So then that would be my question then, is who determines which vaccines are required? Who made...
The legislature technically does, but I would think that they would talk to the health department, and talk to doctors and say, should we add this? Like the HPV virus is one that I think every girl and actually young boy should get, because it protects you against cancer. But it's not going to be communicable in the ordinary sense. I mean, it is communicable, but it's not airborne. So I don't think, there are some states that require it. Iowa doesn't. But I still think you should get it. And that's a kind of a controversial one.
So Centers for Disease Control and Prevention, CDC, they have advisory committee on immunization practices, and that committee actually makes the recommendations. And then based on that recommendations on all kinds of immunizations, this is their job. And based on that recommendation, then other states may follow or may decide not to follow. But usually, because this is a scientific body based on evidence-based science, based on public health practitioner, based on medical advice, so they make recommendations. They can make recommendations only. Then it's up to the states to follow through.
To determine the exact nature of the...
Yeah.
Okay, so that's sort of the process that goes through.
Right.
So the law comes into practice, and can you speak a little bit to then you are part of the living out of that law. Has the state of Iowa, have we had any challenges to the law of Iowa?
No, there's not been no.
There hasn't been.
Again, because I think if people do not want the vaccines, they go get somebody to sign the things, the waivers and from them. But again, that's very few that we have. And people are Iowa is excellent, and Cedar Rapids is excellent. Maybe 3 years ago, they legislate that the 6th graders had to have a Tdap, which is the pertussis booster is the reason they did it, to enter 7th grade. And so we had minimal, I don't know that we had any that said they weren't going to, they didn't do it. We had some that we had to kind of push to go get it, but it was more of a logistic thing. And it's in Cedar Rapids, we're very fortunate that we have the health department. There's not the barriers you have in some rural areas where you can't get vaccine, but or you have to travel to a health department in another city. But in Cedar Rapids, they can get it at the health department. In Cedar Rapids, we actually give it in the schools. We have 3 clinics that have nurse practitioners, and we give them. They can come over from any of the schools and get them for free.
That's what I was going to ask.
Yeah.
If they were, because that's one of the nice things about Mississippi, is if you do not have it. If you don't have insurance, or if your insurance plan does not pay for vaccines, then you get all your immunizations for free.
And that's a federal
Mississippi.
program. That's a federal program, Vaccines for Children, which the health department has, and which we have. All the doctors' offices have it. Well, not all, most. And that's what we have it in the schools. And so if you have no insurance, if you have a high deductible, then we can administer the vaccine. If you have insurance, you can go to your doctor's office and get what they call private stock. But there isn't, there's access. They have it, the health department and right in the school, so.
So there's
you have to
physical
travel to the school,
access,
Correct.
and there's also
But we had
monetary
very
access
little, I don't know that we
Yeah.
had any that refused that Tdap, except for the few,
Religious exemption or
obvious
medical.
medical. We didn't do any kids with a medical exemption, and then the few religious that we have in the district.
But so that's interesting that they just have to get their neighbor to, or anyone to just sign off and say it.
Anybody that can stamp it.
Well, let's see, in Mississippi, before they outlawed it, you had to actually prove from a minister that you were active in a church that was anti-vaccine.
Well, and it's interesting because,
Which I didn't like that.
for a medical
I don't
exemption,
think somebody, that means that somebody didn't go to church, but they
Right.
didn't believe in it. Like, say they were kind of Christian Scientists but didn't attend too well, then they wouldn't get the religious exemption.
Well, we have really obviously just begun to scratch the surface, and we're getting the closing signal here to some of the ethical implications of this debate. It's a complex issue. How do we determine that line between the autonomy of self and one's own choices up and over against the needs of the larger community? It's not an easy project, and one I'm sure that will be continuing to make news in the years to come. I'd like to thank you all for your discussion and your participation in this morning's program. And in addition, to thank you, our audience, for watching us today. So on behalf of the Interreligious Council of Linn County, thank you for being here. Tune in next week and take care.